233.
Hello, my name is Jess. I have been on the ambulance for about 3 months now, probably the shortest out of all of our crew, but I've been elected to give you guys a tour of our truck. So just want to show you what our day-to-day life is like. So come along, let me know if you have any questions, and enjoy the tour. So this is what the inside of our cab looks like. All our trucks are just a little bit different. This is the newest truck that we have. We have 2 4-wheel drive and then 2 van chassis. One is stationed down at the fire station. So here we have our master control. So this turns on our emergency lights. And then we have different lights that we can turn on to see houses better, or if we're on like a car accident scene, we can add more lights. We can also run our patient panel from up here as needed, turn on the different lights back there, oxygen suction, things like that. Here we have our radio that we communicate with dispatch through. So we do all of our radioing through the mic here. And then down here is our sirens. So different settings of sirens that we can turn on as we need to. We as staff have 2 entrances into the ambulance, the back doors and then the side doors. So coming into the side doors here gets you up into the truck, and then this is what it looks like when we don't have patients in it. So we always have our cot ready to go. We have oxygen. This is called our Thomas pack, which has all of our most of our equipment that we need inside a house for any emergency. And then we have our monitor. So that can do all of the things that we need to do. Blood pressure, heart monitor, oxygen. It can do our life-saving stuff like cardioversion and defibrillation, pacing, things like that. So this is our Thomas pack, also known as our go bag. This we can bring into the house and have a lot of our equipment that we may need right there. So we have 2 IV start kits, one with a bag of fluid, tubing as we need, a blood sugar machine, ambu bag if we need to breathe for the patient, we can do that there, thermometer. We have a drug kit in here. This has a lot of our emergency medications if a patient needs it before we get out to the ambulance. We have other airway supplies, more medication supplies. Then on the top here we have manual blood pressure cuff, stethoscope, and then in this compartment we have our airway kit. So that has our ET tubes, other airway adjuncts, things we may need to open up the patient's airway. On both sides we have more dressings, wraps, splints, different things like that. This we call our captain's chair, or our airway chair. From this seat we have perfect access to the patient's airway as needed, as well as over here we have our suction supplies in case we do need a suction. And then up in these cupboards are our most used items. We have different IV stuff, start kits, lab kits, some emergency supplies for trachs and needle decompression, our ambu bag, and then it gets into our other airway supplies, our ET tubes, different advanced airways, breathing treatments, oxygen supplies, things like that. And then our next cupboard, so we have, this is our locked cupboard, this is our drug kits. So we have lots of different medications that we do carry. We have them locked up, and then we also do have medications in the refrigerator that are locked up as well. Coming down the truck a little bit, we have some more supplies that we don't always use, but we have available. In here we have like an OB kit, in case of an emergency delivery. We have our little trauma kit, so that comes with a lot of different dressings, wraps, things like that. Warming blankets, cold and hot packs, different splints up here, irrigation supplies. And then in this cupboard down here, this has like our isolation, decon, different things like that. some different body bags. And then over here we have lift sheets, C-collars, both pediatric and adult, and then some headboards for our backboards. In this cupboard we have this is our pediatric bag, so it has all of our pediatric supplies that we may need, and then we have portable suction, IV pump, and then this is our Lucas automatic CPR machine. So this is a lot of stuff that we drag out for emergencies or can take into the houses as well. In the side compartment we have here different backboards as well as scoot stretchers for moving patients. This is called a stair chair, so patients that are like upstairs, we can get them down easily without lifting them. This goes on the stairs and then it's a track that will run them down with the assistance, so really saves EMS backs with that. So, and then more access to our other C-collars and then backboard supplies. In this outside compartment we have these are splints for different fractures, injuries, things like that, and more extrication boards. When you call 911 and we come to your house, more than likely this is all we're going to be bringing into your house is the cot, as it has majority of our equipment that we need on it. And if not, we'll get you onto the cot and we'll get you out to our ambulance where it has more room to work and it has all of our equipment that we need. So all of our cots are power lift, so really helps save our backs, so they go up and down so we don't have to lift the patients as much.